السلام عليكم. أولاً نشكركم على تسجيلكم وحضوركم معنا اليوم في Future Pathways، المحاضرة بعنوان Dermatology Residency in Canada وبيقدمها الدكتور عبدالهادي. إذا عندكم أي سؤال خلال المحاضرة يا ريت ترسلونها على ال Q&A box بأي وقت حابين ترسلونها وراح نجمعها ونسألها للدكتور نهاية المحاضرة. الآن دكتور هل ممكن تبدأ المحاضرة؟
Okay, good morning, everyone. So my name is Abdulhadi Jfri. I'm a dermatology resident, a fourth-year dermatology resident in McGill here in Montreal in Canada. And so I did my med school in Dammam. I think it's now called University of Imam, but it used to be called King Faisal, and then was changed to University of Dammam, and now they have a different name. I actually stopped tracking their names, and basically, but it's one of the best universities, honestly, in Saudi Arabia. So after graduation, I went back home to Jeddah, and in Jeddah, I joined King Saud bin Abdulaziz University for Health Sciences as a teaching assistant in dermatology. And 1 year after my joining to their department, I was sent to Canada to do my residency training in dermatology. Before that, I went to the state for 1 year. I did research, and then New York, and basically after that, I started my residency here. So basically, first of all, I tried my best to make this talk very simple and understandable. I've always been told that I talk very fast, so I'll try my best to talk very slow and explain everything. I did put a lot of questions at the end of the presentation that I'm gonna go over with you that I received. And basically, if you have any more questions, please feel free to send them either now during the session, or if you're hearing the record of the session, you could basically contact me at Twitter or just email me. So basically a bit of overview of the dermatology. I know you guys had like 2 talks before me, so I've already heard a lot about dermatology. But a bit of my, everyone has their own perspective about dermatology. And then basically what are the available programs here in Canada, and then the workload in dermatology residency in general compared to other specialties, and basically how to increase your chance of getting accepted into dermatology or basically any other specialties that is very competitive. So as you guys know, that dermatology is basically, it's always been known as dermatology and venereology. And it means the study of the skin, which is the largest organ of the body, but also includes the hair and nails. And at the same time, venereology comes from the god of Venus, basically the god of love. And it's more dealt with the sexual transmitted diseases. So that's also our specialty. So there is a lot of misconception in people that dermatology is just about cosmetics. And my mother is one of them. Honestly, like when I started joining dermatology, she's like, why don't you give me like some creams, like for wrinklings for that, can you inject me with Botox and fillers? I'm like, Mom, I'm not doing that. I'm not interested even in cosmetics. But anyway, this is a misconception that people think that dermatology were just about like Botox and fillers and lasers, and it's all about injections, but it's not that at all. It's completely different. And sometimes when I show her pictures of dermatological disorders, she's a bit shocked about what she's seeing. But that's what people think about dermatology in general. The other thing is, so just a branch of dermatology, and we mentioned that we usually cover like 3 parts of the body: the skin, which is the largest organ of the body, and usually it's the mirror of internal organs. We pick up a lot of diseases, from like rheumatological disorders, internal organs. Sometimes we pick up, like, for example, diabetes just by looking at the skin. So it's really important mirror of what's going on inside the body. I mentioned also the hair and nails are part of the skin, and it's like the skin appendages, and that's why it's also included in dermatology beside the sexual transmitted diseases. So in Canada, the dermatology residency program is a bit longer than other countries. It's 5 years here, while in the States and in Canada and Saudi Arabia, maybe in France, it's only 3 years, and the first years usually they call it prelim, or just out of dermatology, they do like internal medicine or pediatric, for example. So it's longer than any other country, that's for sure. So here the structure is the first 1 to 2 years are usually in medicine. And so we do a lot of specialties in medicine. For example, we do rheumatology, we do allergy and immunology, because it's important to rotate in these specialties because you will see patients suffering from skin diseases that also have rheumatological problem. For example, patients with psoriasis, they tend to have something called psoriatic arthritis. So you need to be aware of, rheumatology, at least how to do a basic rheumatological exam. You don't need to be a rheumatologist, but at least to have an idea of what's going on in this specialty. For allergy and immunology patients who has, for example, urticaria, so you need to know also how to take like history, when to refer to other specialists as well. So the first 1 to 2 years are in medicine, and then 3 years in dermatology. In our program that I'm in right now, I did only 1 year in medicine, and then the rest were in dermatology. So basically now in my 4th year, and in like 2 weeks, I'm gonna start my final 5th year. There is a big difference between the United States programs and also the programs in Saudi Arabia. In Canada, all the programs are affiliated with universities. And we don't have so many programs. So we basically have around like 8 to 9 dermatology programs. And all the programs are under the umbrella of the Royal College of Medicine. Why is that? Is they maintain a same level of excellence of training among all the programs and make sure that all the programs provide the same level of training to all the trainees. So that's a bit different from USA, Europe, for example, because in Europe and USA, you could join a program that is not affiliated with a university, like just with a hospital, and basically they don't have that good level of training. And then you can go to another program which is superior than all the programs in Canada, for example. Europe, the same thing. But here in Canada, no, they make sure that wherever you go in Canada, there is a little bit of a tiny variation among the programs, but still, they all have the same level of excellence in training, honestly. So that's a very reassuring good thing. This is basically what we mentioned, but in just like more details, if you want to read it later, basically what is the structure of the residency, and we mentioned the first 1 to 2 years are usually in medicine. So basically, also you want to think ahead, like if I did, for example, dermatology, what would be my, for example, fellowship opportunities that I want to specialize in? Well, the good thing in dermatology, there is a big, wide range of different subspecialties. You could be a dermatopathologist. Basically, you don't see patients anymore. You could just sit in the lab, because in dermatology, sometimes we take a small pieces of the skin and we send it to the lab to be analyzed under the microscope. So you could specialize in dermatopathology and basically just be in the lab, and not saying that everyone specializes in dermatopathology, usually goes and restrict themselves in the lab. You still can work in clinic, with a good dermatopathology background that every dermatologist need, and basically you would give more interpretation to the results. That's one thing. The other thing, you could do the PEDS dermatology, and basically you just see patients under the age of, I don't know, 18 or 12, based on where you are. You could also do dermatological surgery, and basically dermatological surgery is, you could also do dermatological surgery. Basically, you could just do surgeries, excisions, for example, and be a very surgical dermatologist. And in that field, you could be also expert in lasers, for example, or hair transplant. Because for hair transplant, you can't also do, it's difficult to do other patients at the same time, because for hair transplant, maybe you could do 1 or 2 patients a day. So that will take the whole day. So you can't see patients for, other complaints, for example. You could do cutaneous oncology, but then you need to work in a center where they have cancer, and you could see that the side effects of the cancer treatment, the chemotherapy, they have tons of cutaneous side effects that sometimes can be a reason why a patient would stop the chemotherapy, why the patient would stop the new biological treatment. You could specialize in laser and light, but also that can be under dermatological surgery, or can be just a separate subspecialty. You could do contact dermatitis and patch testing, and that alone is a big different field. Basically, patients who are wearing, for example, watches or having necklace or having some, the belt allergy to plants, to perfumes, to certain, clothes, for example. So basically you take pieces of chemicals and you put it on the back to see if they sensitize to it. And then basically you tell the patients, what, you're allergic to nickel. And where is nickel? Nickel is in chocolate, nickel in canned food. So you give them a lot of advices on how to avoid the exposure to that allergen. So that's a big, big field that honestly requires a lot of memorization. Then you could also be specialized in something called dermatology and rheumatology. And basically in that field, you should be able to do like a basic rheumatological examination. You'll see patients with like lupus, dermatomyositis, psoriatic arthritis, all these complex dermatology. You also could specialize in something called advanced medical dermatology or complex medical dermatology, which is something honestly, personally, I love so much and I want to specialize in. Basically, complex is different, like everyone thinks have their own complex, but basically you see patients with immunobolus disorders, patients who are really admitted in the hospital and sick. So you don't see just, acne and eczema and basic dermatology diseases. Immunobolus diseases, and basically can be under advanced complex or can be just a separate field. And then basically you could be specializing more in epidemiology and research, especially if you're working in an academic center. So what are the available dermatology residency programs in Canada? So basically we have 1, 2, 3, 4, 5, 6, 7, 8, 9. So we have currently around 9. This is like when I checked yesterday, because I told you they're all under the umbrella of the Royal College of Medicine. So basically they could check the programs, and if they don't see it providing good training, they could close the program. It's very possible, or put it on hold for a few years until they regain their level of excellence, and then they open it again. So the programs here on the right side, the Université de Montréal, Université Laval, both of them are French-speaking universities, which means that you require a French language proficiency level to be able to enter these universities. I basically studied French when I was in med school, like just to gain another language through all my years. Basically, I applied to Université de Montréal, but then when I matched to McGill, I did not go there. So this is something to consider. And honestly, getting to McGill, having a French language was a very positive point in my CV, because in the province of Quebec, people speak French and it's considered as the first language. So you will see a lot of patients that are unilingual and only speaking French. Some of the Saudi and only the Saudis and international students find a bit of difficulty communicating with the patient. So if you're applying to the program and you have French language in your CV, that will be a very positive thing, especially if you're applying to the province of Quebec, but that does not matter if you're applying to Toronto or Vancouver, for example. So University of McGill is the one that takes a lot of Saudis, honestly, for the past years. And I would say after that comes University of Vancouver. There are a lot of Saudis fellow in University of Toronto, but they don't take Saudi residents because they require 2 years of internal medicine and North American program, which is difficult. And basically you need to go to Canada or the state to do 2 years of medicine and then apply to them. Okay. So if you look at the map of Canada, for example, Vancouver here is on the left side in British Columbia. And we're here in Quebec. And Quebec, we have Montreal, Université de Montréal, and also Laval. And the province, as we mentioned, is the first language is French. And so you need to have a bit of a French level to communicate with the patients. It's not necessary. Like a lot of people finish the program without knowing a single word in French, and that's okay. But I'm just saying that I found it very, very extremely important and makes your life easier. You have to consider the weather. So Canada is so cold and it's colder than the United States, especially if you're here in Quebec part, it's really cold. Like for 8 months a year, of snowing and cold, like we're in winter, we're in summer right now, and yesterday it was 8, 9 centigrade. So it's cold. A lot of people ask, why did you decide to go to Canada and not to do your residency training programs in Saudi Arabia? Beside the solid structure teaching that I find in the North American program, especially in Canada, there are a lot of other advantages. And the biggest advantage is to see patients of different skin color. And you see, this is the same disease like psoriasis, but the presentation in patients of dark skin color is completely different than patients of Caucasian or white ethnicity, for example. So I always tell them that I wanted to be confident in me dealing with patients who comes with different skin colors, because the thing that you have to know in dermatology is basically based on the skin color, you might see different diseases that you never see in the Saudi population, for example. That's for sure. And you could see some diseases in the Saudi population that is very common here, but it's really rare in Saudi Arabia. And basically, it's different, completely different. And also some skin diseases are completely dependent on the geographic location. For example, skin cancer, such as a very common thing, it's the commonest skin cancer. And I think the second most common cancer in the world is basal cell carcinoma. It's very frequently encountered here, like we see it on daily basis, because most of the population here are of like Caucasian white ethnicity, but it's really uncommon in Saudi Arabia. Sometimes they even report it because it's considered uncommon. And then the presentation, as we previously mentioned, that it could be completely different in different skin colors. And you know, Canada has a lot of immigrants from all over the world. So you can see people like Jewish people from Israel, from Ashkenazi descent that could be predisposed to certain skin diseases. You could see people of African origin, from Haiti, from Nigeria, I don't say that we don't see these patients in Saudi Arabia, but you see all different colors here more frequently, you know? So I think you build up a very good level of confidence in dealing with all these skin types. And basically, you never know, like Saudi is opening their doors to the world and becoming an international country, you know, with everything. We're really developing so fast. And I think in the future, we'll have a lot of people of different skin colors in Saudi Arabia. So for me, I wanted to be like internationally oriented dermatologist to be able to deal with all these with a big confidence. The question that I always get, how to stand out, how to increase my chance of being acceptance, not necessarily into dermatology, but in any subspecialty. And my advice is always have something good from everything. Like if you have the best GPA and the best like license exam, it depends where you go. For example, if you go to the Canada, to the state UCMLEs, and to the Canada is the MCCEE or the LMCC, but you don't have any research activity, you don't have any good recommendation letters, and you haven't done any electives or observership, for example, in a North American program, your chance would definitely be lower than someone that has an average score with, you know, good research, good recommendation, good training experience in North American program. And you also have to have like an important, an interesting personal statement. A personal statement is usually the first paper that comes in any application, and it basically a story why you want dermatology. So it needs to be a very interesting and attractive story instead of being a repetitive and something they heard a lot over the years. Research scholar activity are very important, and how to do a research when I'm medical students, you know, like is it difficult? Well, I have a video and a course on how to do at least a case report that I'm going to give you the link at the end of the talk, and you can go to it. I think over 10,000 people registered for that course, and the review I received was excellent, and people actually were able to do case reports afterward. So you need to do an elective in North American program, and this is something you could plan from now. Is basically to do 1 month of elective in your last year of training, the 7th year. For me, I did 2 months of electives because I decided in 5th, 6th year that I just want to do a North American program. So basically I did 2 years and I did 2 months, and one was in the program that I'm in right now in McGill, and I did 1 month at Harvard. So I did 2 months of elective, and then I took a really good recommendation letters from Harvard. I did it at the I was at Mass General Hospital in Boston. I did 1 month here at the Royal Victoria Hospital in Montreal. So French language, I mentioned, is very important if you're applying to Quebec, just to give you more options. English proficiency exam is required by few universities. If you're, for example, studying in Saudi Arabia, I know in Saudi Arabia, our universities have an English teaching environment. So you need a dean's letter that states that the teaching environment in your school is in English and you have a proficient level of English communication. I don't think why would you go to that if you could just do TOEFL and IELTS? And for the TOEFL and IELTS, usually they require certain scores in certain sections. For example, you should score above 25 in speaking or writing at least. How to do that, I also have a video for that, and I've done few files and courses, and the recent one was in April this year because there have been a lot of changes in these exams, and we'll tell you in depth how to prepare for these exams. Then basically, if you work with them and you show them that you're a punctual, respectful person and, come on time, leave on time, always, you're good, safe, honestly, they're going to take you. The level of knowledge does not matter because you have 5 years to learn everything. So they don't look at that at all. I don't think all the programs around the world, they look at your level of knowledge in dermatology, because what is the point if you're going to go through a residency program? You're going to learn through that. They want to know that you're a good person that they can live with for 5 years. They can see your face for 5 years, enjoy talking to you. You're not going to make any problem and you're not going to make their life difficult, That's the most important thing. And then basically you need to adapt very fast to a different culture. There are a lot of changes and different, things in their cultures, the way to say, how to welcome people, how to wish them to have a good day, and I don't mean by adaptation that can be understood by a couple of people. That means that I have to do like them, like I have to eat pork like them. We have to keep our tradition and cultures and religion and respect it very well and behave very well and represent our country, Saudi Arabia, very well. But at the same time, we have to adapt to a different cultures. We can't take everything we do in Saudi Arabia here, literally. So you need to adapt to their culture and respect it. So let's you don't have to tell me, just in your mind, think about it. You have 2 applicants, Applicant A and Applicant B. Applicant A basically has the license exam for the Canadian with a very high mark, but he doesn't have a research, and he did 1 elective in dermatology in Saudi Arabia, and he liked dermatology in Saudi Arabia, but he wanted to apply for Canada, for example. He attended few dermatology courses back in here in Saudi Arabia, and he had 3 recommendation letters were given from Saudi staff who trained in Saudi Arabia. Applicant B has an average GPA with an average exam score for the MCCE, but he has 2 case reports published. He did 1 elective in USA, not in Canada, but he has 2 recommendation letters from the 2 US dermatologists, and also from 1 dermatologist in Saudi Arabia who finished his training in Canada, and he attended few conferences that were done by the American Academy of Dermatology in the States. So between those 2 candidates, which one do you think that he has the higher chance? That doesn't mean that candidate may not get in, Maybe candidate B, for example, has, they worked with, they did not like, he has a lot of issues, or he didn't do well in the interview. So I think it's basically the answer here would be candidate B would have a higher chance of getting acceptance based on my, personal experience. So I don't want to complicate things, because if I give you the steps and details, honestly, just before the application, you're still medical students, you will totally forget it, and things are changing over the time. So the most important thing is the application in Canada is completely different than the United States. So in the United States, I'm pretty sure that you heard from the previous speaker that you may be able to apply, and then if you get acceptance, you can look for a sponsor. That doesn't happen here. So here you need a letter that states that you have a sponsor, and you have to send it to the Saudi Cultural Bureau in their online website, and then basically fill the online application, and they're gonna send your application to the universities. And usually that happens between May and June. And then after that, once the postgraduate office of every university receive your application, they're gonna look at, send it to the dermatology department. They're gonna review your application, and they're gonna see your like application, CV, and personal statement. And based on that, they're gonna rank the applicant. They're gonna send the names that they wanna invite for interview. They will go back to the Saudi Cultural Bureau. They're gonna email you to that you have an interview, and then you're gonna come here October, November. Interviews like Monday, for example, Friday or next week, you're gonna hear that you matched. For me, it was next day. My interview was Thursday. I knew I matched on Friday. And basically you start the next academic year. The first year I applied, there was no any opening for dermatology. So I just waited 1 year without any program. And that's another very important thing in dermatology. You have to be very patient because sometimes it takes really time to get in. If you really love it, do it. And don't go to another specialty because you could not match in dermatology. If you could wait and you really like it so much. And in terms of salary, we get a good amount of salary. We get the money from the Saudi Cultural Bureau, which is around $2,000 Canadian dollars, and basically 1,015 from the hospital or the university. And then basically you get, because we are sponsored from Saudi Arabia, you're gonna get your home sponsor salary. That's around like 3,500 to 6,000 based on your sponsor. Like mine gives me, I don't want to say less than what they give me, but basically it's around like 3,400. And basically based on what the expenses, based on the city where you live. If you live really downtown, it's going to be pretty much higher than, you know, a bit in the areas away from the downtown. And, you know, it depends on what you take as well. So I mentioned that one of the important things for any medical students applying to any residency program is to have some publication. And for publication as a medical student, it's hard to do, you know, large types of studies. And basically what most of the students are doing all over the world, especially, you know, everywhere in the world, is case reports, because they're easy to publish and easy to do as a med students. How to get involved into a case report and how to write a case report. If you go to this link, you will see the course that I've done. And usually I told you it's more than 10,000 people registered. And honestly, the review I received is amazing. And it's very simple. The other thing I told you that sometimes when you apply, even for Canada and the States, you need a TOEFL or an IELTS because we're considered as an IMG, and IMG means International Medical Graduates. And for TOEFL and IELTS, you need to have a certain scores in certain section, and how the details about the exams, how to score high, and really I'm breaking down this section into parts and explaining every part in detail. So basically you can check that in my Twitter account and you will see the session. I'm gonna go over a few questions that I received before the session, and basically I'm gonna see your questions here as well. So the acceptance rate among Saudi applicants, so it's very difficult. The year I applied to the first year, that was 2013, there was none. The next year I applied to was 2014 or 15. I think I applied 2014, so they did not take any Saudis, and then I applied 2015 and I matched and I started 2016. So it takes time. They don't have many seats for sure. And I told you that maybe the university that's provide more seats and they have availabilities could be maybe University of McGill or Dalhousie, Vancouver, you know. How to increase my chance of getting accepted? Honestly, it's something of everything. You should have a good CV, good personal statement. You did one elective in North American program. You have good personal good recommendation letters from people they know, and basically have some research activities. You've done a few courses and workshops in dermatology. Requirement to look for in candidates CV-wise. So basically CV is collection of what have you've done. So if you've done more, you have a good CV. So when I was a med student, I did a lot of volunteers. I did a lot of workshops in diabetes, endocrinology, multiple sclerosis, hypertension, everything. They have volunteer. They have, you know, workshop conferences I usually attend because I didn't know what to go to and I did not decide yet. So it was going something from everything. But when I applied, honestly, I removed them from my CV. I wanted my CV to sound only dermatology. So this is a personal decision. You could keep them, but I think do not distract them. Just leave everything dermatology if you really know that you want dermatology. What are the different subspecialties? So we went over the fellowships. So basically you have dermatopathology, peds, surgery, patch test, allergy, you can do cosmetics, so Botox, and just, inject Botox and fillers and lasers, and do not do any medical dermatology. You can do that totally. However, we don't need that. Daily aspects of dermatology. So basically the workload is not heavy at all. And the good thing about dermatology is they looked up all the subspecialties, and they looked up who has the best social life, and they found that dermatology ranked on the top of the list, that they really had a great social life. So the workload is not busy. For example, if you're someone who likes to do sports, who likes to play, I don't know, music, who likes to paint. For me, I like painting, I like doing cross fitness. So for me is, honestly, these parts are very important parts of my life, and I want to maintain them, and I want to keep doing them. That's one of the things why I decided to go to dermatology, because they're as important as dermatology for me, and I want to keep them. I don't want to work in a specialty where I finish 8 or 9 at night, and then basically I don't have time to spend with my family or do these extra, work activities that I enjoy as much as enjoying working in dermatology. The on-call is not bad at all. So the first year, but you're going to be in medicine, so you can have in-house on-calls where you go sleep in the hospital, but it's very few calls. And then basically on-calls are from home and starts after 5 until next day in the morning. And sometimes you can, 1 week can go without having many calls. And again, it depends on where you're staying and where you're on call. If you're on call at the adult side or peds, it's dermatology at the end and it's skin issues. Yes, we see emergency, but not as many as other specialties, let's be honest. The work hours per week, every week we start at 8 and we finish around 5 every day from Monday to Friday. Weekend we're okay, unless we're on call, and that's not many. For my 5th year, I received my own call schedule, and I'm just on call 3 weeks in my 5th year, which is nothing, honestly. What are the things that make you stand out? I mentioned that's something from everything, like CV wise and training wise. Seats for consultant position in this specialty, or is there a saturation? So this is a difficult, because if you want to go to dermatology in Canada, you need to have a sponsor, and finding a sponsor can be a bit difficult. For me, I saw my sponsor is back in Jeddah, and the university that I'm in, there are not many people who went to the States, but I know the one in Riyadh, they have so many people who went already to the States and Canada. So it depends where you apply. And honestly, I applied everywhere. I even applied to Jazan, I applied to Al-Hassa, for example, and I went to interview and I matched there. But then when I applied to Jeddah, I preferred to go near my hometown. But you could go to anywhere if you like dermatology, the process in choosing the residency you wanted. So this is a very, very important question that I get a lot. Like, how did you decide that you want to go for dermatology, and how do you decide to go for any specialty? My advice to you is, do not decide just based on reading or listening to me, or reading over the internet or anywhere. Go to the same specialty in Saudi Arabia, ask the staff there, like the consultant, tell him, what, could I come just for a week as an observership? Most of them would not mind, and go there every day in the morning until at the end of the day for the whole week. And then after that, sit by yourself during the weekend, close your eyes and say, if I am waking up every day and going to that work, seeing those patients for the rest of my life, would I be a happy person? If the answer is yes, then this is for you. If you're a visual person, if you're a person who enjoys seeing patients or different presentation, because psoriasis can come in 10,000 different presentation and it's the same disease. Eczema can come in, over 1,000 different presentation. So it's not boring at all. But if you're, hopefully no one here in endocrinology, but if you see like diabetes or hypertension, it's always the same. It's always the same numbers, and you're treating numbers. And it's very satisfying in dermatology when you give topical treatments or medications and you see the rash disappear. The disappearance of the rash The rash gives you a lot of satisfaction, and that's something I really enjoy in dermatology. So it depends on you. So I knew that I wanted to go for dermatology when I was in my 5th, 6th year, and I decided to go for North American. And you need to have a supportive family because a lot of years outside home, and your family needs to support you. Honestly, like my mother told me, I think a lot of intern in Saudi Arabia told me, "Oh, why do you go for dermatology? It's impossible to do it in Canada or the city. It's a very impossible specialty." So I listened to them, unfortunately, and I prepared my application to do it for the Saudi program. And at that time, it used to be a CD where you put your files back in the days in 2013. And then my mother saw it and she said, "Wow, you're applying to Saudi Arabia. I thought you want to go to Canada and the States." I said, "Yeah, but my friends told me, the chances is like nothing, very difficult, and I need to give myself other options." She said, "No, if you want it, just do it. Even if you're like 40, do it." And then honestly, I just needed someone to tell me that I did not apply at all. I wish I knew. I think I was lucky enough that I met people who really, really matched in Canada and the States when I was in my 3rd year in medical school. So I knew the things that they look for and I prepared myself very well. When I applied, I had 7 publication case reports, and I already did 2 electives, one in Canada, one in the States, and I had like a lot of good recommendations all from the States and Canada. That's increased my chance a lot. So I'm gonna go to your questions right now and see if you guys have, can you please come back into salary slides? So someone just want me to go back to the salary slides. So I'm just gonna go back to the salary slides. So this is a salary slide. Plastic will be the case report lesson is closed. How can you get into a doctor? So for the case report, you just register, and then basically they're gonna send you have to make an account with them, register for the course, and then they're gonna send you a link and you can go to it because you can watch it. It's recorded and it's always available on the website. Greetings, doctor. I finished my internship this month. If I apply to Canada program next year, May, June, would it be? So if you apply for next year, it's going to be the year after. It's going to, if you apply next year, 2020, 2021, it's going to be 2022, not 2021. In your opinion, which one is better, US or Canada? So I would suggest, I did the USMLEs, I even did step 3. For dermatology, you must do the steps, honestly. They have so many programs in the States, but again, we're going back to the point that some programs are in the middle of nowhere and they're not as good as non-programs in big centers and big cities. So, but in Canada, they have the same level of excellence everywhere. So I think it's very important to do the USMLEs to increase your chance. So that's something that I did, and I recommend everyone to do. If I don't get in during my first attempt, what do you recommend? So if you have 1 year of a gap, I don't recommend that you just sit home. Basically, you have to, in my year gap, I was a teaching assistant in the College of Medicine. So I was with med students, helping them with their problem-based learning sessions. But at the same time, I was doing research. I was doing, so I published a lot of case reports. And honestly, I say to myself that I was lucky that I applied, that with my first attempt, I did not get in, because if I get in with my first attempt, I may not have a good chance, because I had time to do researches and work more on my CV. I didn't understand the point of sponsorship. The point of sponsorship is basically to apply for Canada. You cannot apply without sponsorship. So you need a letter that you are sponsored to apply for Canada, for Canadian programs, but you don't need that for the States. What are the requirements to take dermatology electives in Canada? Nothing. I mean, it depends on the university, but basically just you have to be in your final year of training. Some of them, they ask for TOEFL and IELTS, and you have to do it. Some they ask for just a letter of English proficiency from the Dean of College of Medicine, and that's something you can get from the secretary. So the salary we went to do researches have to be in dermatology related. So that's a very important thing. Some people ask me, like, I've done my researches in dermatology, in ophthalmology or in medicine, but I did not do any research in dermatology. Can I still include them in my CV? And I say, if you don't have anything, yes, include them. But if you have dermatology, I would prefer keeping the dermatology, but you could add them because it also tells that you have a dermatology experience, you know. Are NAC exams required for Saudi? I don't know. They're not required as far as I know. Basically, you just have to do the LMCC, which is the Canadian exam, and have TOEFL and IELTS. What are the exams required to get into Canada? There's just one exam. It's called Medical Council exam. And basically, it's a computer-based exam, and it's MCQs, and you can do it. I did it, I think, in Jeddah, so I can do it back home. What are the major cons of studying dermatology in Canada? So basically, just the travel experience is amazing. You see patients of different skin colors. We mentioned that the different presentation of different skin colors, and you know, just the work experience is completely different. And honestly, you're gonna work your whole life back in Saudi Arabia, so why not travel and have some experience outside? So I think I went to the questions in a different direction. So now I'm just seeing the most recent questions. I have an account, but it wouldn't open. Would you maybe? Okay, so basically, maybe I will try to post the link on my Twitter account. Is dermatology acceptance as hard as has plastic surgery? Yes, it's hard, and plastic is hard, but dermatology, I would say, is harder. Dermatology and ophthalmology are like the most two competitive specialty. If I have a master's degree, does this increase my chance? I think it increases your chance in. I have a master's degree, so but I get my I granted my master's degree while I was doing residency. But basically, master's degree will make you more academic person, so it will increase your chance for sure, because most of the residency in Canada are like academic centers. I think it will increase your chance everywhere. Even in Saudi Arabia, if you're applying to a university. About USMLEs, they mandate important just for USA, or they do increase your chance in Canada as well. They're not important in Canada, but they increase your chance in the States. And I heard some programs in Canada, they can waive the Canadian exam and consider the USMLEs, honestly, but you have to double check that because they change. Since you've done both USMLEs and Canadian exam, would you say the prime difference were? So the Canadian is one exam, USMLEs are a lot of exams. You have step one, which requires a lot of basic science and studying. And then basically step two is one clinical, which is you have to go to the States to do it, the CS. And then you have the step two CK is similar to the Canadian one. And I would say the steps, the USMLEs are much easier. The Canadian exam is hard, honestly, in a stupid way, because the questions are really badly written. But now I hear that they changed a lot the exam and become easier and straightforward. So, and then basically the third step of the assembly is 2 days, and it's computer based and 9 hours. So they need a lot of preparations, a lot of time, and they're time consuming, but they're worth doing, honestly, to have them in your CV. I like dermatology also, but I don't like conducting researches. Does that mean dermatology doesn't suit me? No, it doesn't mean. And I know a lot of people who got accepted into dermatology who do not have any research. So it's not, I'm just saying to increase your chances, better to have something from everything, because we mentioned that the programs of dermatology, because think about it, the program when they get in, and the staff who are working in the program are usually affiliated with the universities. And to increase their record, they want to have more publications. So I want a resident who comes to my program, when I face a case report in the clinic, I want that resident to write that a case report. You know what I'm saying? So that this is, know what they're looking for is basically knowing how to prepare yourself. So just a fresh graduate, where does this journey start? I mean, at which platform we start contacting who and where to find available sponsors? So you need to look for, so basically for me, sponsorship, I just was like Googling all the websites for universities, for hospitals in Saudi Arabia. And then basically I was looking, you know, sometimes it's not in the website and they just post a paper in a hospital. So you have to tell everyone from your friends that if you're looking for a sponsorship in certain specialty, they're going to help you finding somewhere. And sometimes you could just go and contact them. Like I contacted certain hospitals and I told them, could you sponsor me? And they said, you know, you need to have an acceptance. But then how could I have an acceptance if I don't have a sponsorship letter? So that was the struggle. Tell us more about the Canadian exam. So the Canadian exam is like the similarly CK, basically just medicine. They don't have basic science, so they don't have chemistry or, like basic science. Is just basically a clinical exam, how to diagnose hypertension, treatment, diabetes. It's very general, but then you have a section where you have a lot of questions about the ethics, and it's completely different than our ethics in Saudi Arabia. Like, for example, how to treat minors, how to treat people who are like drug abusers, breaking confidentiality, what to do. The HIPAA system is very important to be aware of. But these things you're going to get and understand when you prepare for the exam and you use the resources for the exam, like the website. You will be well prepared for it. So don't worry about that at all. Can you explain sponsorship? Do you take it as academic? So the sponsorship, you can be sponsored in a university like me, for example, and then basically you could go do your residency and then come back and work in a university as assistant professor of dermatology. Or if you don't like the academic work, basically you could be a sponsor with a hospital, like for example, the King Faisal Specialist Hospital. Basically you go there, you do your residency and come back and work with them as a, as just a dermatologist. So it's based on where you go for your sponsorship, or you can be sponsored with the Ministry of Health, and that's also a different thing, that they will finish your training, and then basically when you go back to Saudi Arabia, you have to look for work, so because you don't have a sponsor. Okay. I think there is something with the case report course that is closed. I'm gonna double check with them and I will make sure that it works, and I will post that on my Twitter account so you guys can check it later if you want. So if you guys don't have any other questions, thank you so much for having me, and just be patient. And my advice to the recent graduate and medical students is basically, if you go do any elective in your last year and someone asks you where you want to specialize in, do not tell them dermatology, because they're going to tell you, oh, it's impossible, and give you a lot of negative impression about dermatology. Just tell them, the trick that I used is basically, if I'm doing OB and they tell me, oh, did you decide where you're going to for? I was like, I'm still exploring. I like everything. And that was my trick, telling everyone, because you don't have to tell them that you want dermatology. Just keep it for yourself, because if you're applying, especially abroad, because it's different. Once you get your Canadian board, inshallah, where is it valid? So basically, it's a North American, it's well-recognized certificate, and I will be able to work everywhere, but I'm gonna go back and work in my sponsor in Saudi Arabia, which is gonna be the King Saud bin Abdulhadi University for Health Sciences in Jeddah. Okay, I think I finished answering most of the questions. And
thank you so much, Doctor, for taking the time out of your day to present this amazing lecture and answering all of our questions. Allah يجعلها بميزان حسناتك يا رب. يعطيك العافية.
You're very welcome. And this is my email account and also my Twitter account. I'm trying to be active on Twitter. And basically, if you guys post any questions, I usually respond within 24 hours. I promised you I'm gonna put post the case report preparation course. I will see with them why the link is not working, and I'll make sure it works for you.
Thank you, Doctor.
Have a good day. Bye.